Hi, everyone. Thank you so much for joining us today. Today, we're going to be discussing um, the role of registered behavior technicians in public school settings. So my name is Diane, and I'll be your moderator for this conversation. I'm a board-certified behavior analyst with 19 years of experience in the field, and I'm passionate about bringing high-quality practical dialogue to the ABA and educational communities. So today we're diving into a really important conversation and topic about how RBTs can support students, educators, and the school system. So we're going to explore why they're essential in today's schools, how to blend that educational and clinical support, and how to find and implement these supports in a sustainable way. So it is my absolute privilege to be joined by these phenomenal panelists, each bringing a unique perspective to their discussion. So we'll start off first, Dr. Quinchana Smith. She's a seasoned special education leader and the special education coordinator for Richmond County, Georgia. She brings deep expertise in inclusive education, behavioral interventions, and systems level change. Next, we have Nicole Robertson. She is a board certified behavior analyst. She transitioned from a career in IT to education and now specializes in school-based ABA. So she brings hands-on experience introducing behavior analysis teams into public schools and is an advocate for creative, sustainable, collaborative integration of ABA with public education. Next, we have Marissa Croft. She is an educator and board certified behavior analyst with a strong background in both general and special education. She combines clinical expertise with compassionate leadership, driving evidence-based practices, team development, and client-centered care. Last but not least, we do have Marika Hollis. She is a registered behavior technician and the school recruiter with iDEAL Hire. She brings insight into both the staffing and clinical aspects of ABA in education and works closely with districts to find the right talent for their behavioral support teams. So welcome, everybody, and thank you guys for joining. So I do have a poll for everybody here just to kind of get your perspective and kind of figure out where your current role is. So if a poll up, I'll give you guys about 45 to a minute to answer, and then we'll kind of move on to the next topic. Give you guys another about 15 seconds to get your answers in. Okay. So it seems as though we have primarily direct support staff on our webinar today, so welcome. We do have a couple of administrators and a couple of educators and a parent as well. So thank you everybody for joining us. So every district is searching for practical, effective ways to support students with complex behavioral needs, especially amid staffing shortages, increasing demands on teachers. So whether you're considering RBT support for the first time or looking to expand existing behavioral services, the session aims to provide insights and inspiration to help your district build a stronger support system for students, teachers, and the community as a whole. So we're going to talk about kind of RBTs, registered behavior technicians in the classroom. So I want to start off by kind of sharing with you guys, kind of going over some of the acronyms you guys might be hearing. I want to make sure that we kind of explain them clearly. So Nicole, can you kind of give us a little bit of a breakdown on what is a board certified behavior analyst, BCBA? What is an RBT? What are they supposed to do in schools? And why is it beneficial for them to be in that classroom?
There we go. Sorry. Absolutely. So I'll start off with board certified behavior analyst. So as the name implies, we're certified professionals, and I am a BCBA, by the way, as Diane said. But we're certified professionals. We all have at least, some graduate level education, master's or doctorate. And then specialized training in the science of applied behavior analysis. So we love our acronyms in this field. So you'll hear
Mhm.
ABA and BCBA, and that's what we're talking about. And so what do we do? ABA, or applied behavior analysis, has a wide range of applications, but we often work with individuals with developmental disabilities and individuals with autism. And our goals are to help improve functional communication, help them acquire adaptive skills, and then a big one is to help reduce challenging behaviors. The way that we go about doing all of these amazing things is that we start off by assessing behavior. We really focus on why a individual is doing what they're doing, and then we take that information and we use it to create applicable interventions. And we do train and supervise therapy teams. And so our whole our whole talk is about RBTs, and one of those, the key components in our therapy teams, is the registered behavior technician. And so, Marika, who is a registered behavior technician with tons of experience, can you tell us what they do?
Hi. So my name is Marika and I am a registered behavior technician, also called an RBT, and pretty much my role in the classroom or in a clinic setting, home setting, is to follow the behavior plan that the BCBA writes. During that time, they're targeting, behaviors that need to be addressed, and I'm working hand in hand with teacher, parent, or BCBA on how to address behaviors as they occur and things of that nature.
Awesome. Dr. Smith, so for districts that currently don't have RBTs, what are they missing?
So one of the things as a district, when we're looking at providing that support for our students, we look at what are the needs, and then also making sure we have those resources. So pairing with some of our contracted staff, our contracted organizations, such as iDEAL Hire, looking at some of the things that they offer. Such as paraprofessionals or RBTs if it's a specialized area. We overall look at what are the needs that we have in our different programs. So looking at that first and seeing the need and having that conversation about how can Ideal Hire best help our district. So being able to look at the supports that are needed for each individualized child.
Awesome. Now, how has the presence of RBT shifted the dynamic for educators and kind of the support staff? Dr. Smith or Marissa, if you guys have experience in schools, how has the dynamic shifted and what kind of supports have they provided for the learners?
As a former special education teacher and now BCBA clinical director, in the school setting, you now notice that we see a more wide range of increased diverse behaviors in the classroom. So you're seeing more aggression, more elopement, more anxiety related behavior, more task avoidance. But that comes without the parallel increase of trained personnel staff. So the registered behavior technicians, or RBTs, under the supervision of BCBA, they can come in and close that gap for the classroom and the consistent structure, that we can make sure that the students' BIPs, or behavior intervention plans, are followed appropriately with the perfect prompt levels and things that RBTs can provide. Because one thing that we notice in the school settings, and sometimes it's the lack of training behind these type of classrooms or children. So RBTs could bridge that gap for the training and the assistance that these students need.
Yeah. Now, as BCBAs, we love to make sure that our skills generalize, right, across settings, across people. So how does having an RBT in the classroom help our learners generalize those skills, the behavior reduction goals, those functionally equivalent replacement behaviors? How does an RBT in the classroom help that happen?
I would say they bring more of a consistency. Those RBTs are more familiar with the collecting of measurable data. They're able to provide effective reinforcement strategies because they have that support of a BCBA that has provided them with the training needed in these specialized classroom settings. So those are the ways that RBTs can help, because they have a different level of training because they know those specific behaviors, and they can collect the data and the strategies at an effective level. across, which can teach the children how to generalize, on top of teaching the teachers as well how to appropriately generalize these skills.
And I just wanted to add, generalization is when we don't just want the kids to be able to do this amazing thing only when they're in this one setting, working with this one person. And we see that sometimes with the clinical setting. I think this is where the school setting shines, is that there are unlimited opportunities to practice and to teach in the moment, how to appropriately engage in social interactions, or how do we actually functionally communicate that we need help or we don't like this particular task instead of engaging in the behaviors. And so, like Marissa alluded to have somebody who's very trained in, following these interventions and then also collecting the data on it, there's so many opportunities to teach in a classroom setting. So I think that is the best part about the school setting, and having RBTs be able to do ABA in the school setting, is that the opportunities to learn how to use these skills in different environments is just limitless.
Absolutely. I think we need to remember that generalization is so important for maintaining behaviors and for that long-term goal of independence and improving the quality of life. So, Dr. Smith, can you tell us a little bit about what is effective collaboration between RBTs and the school staff, from the administrative level to the teacher level? What does that look like in the schools?
So in the schools, typically we just go ahead and we have that conversation. We bring everyone together, and it's like a well-oiled machine. So for instance, the principal is aware of the staff, the administration. When I say administration, at the district level, the principals is aware, as well as the assistant principals, the teacher. We bring aboard the parents as well in the meeting. We look at the IEP, we look at the plan that's currently in place, and then we have options to look at how can the RBT, as well as everyone, not just the RBT implementing, but how everyone can be of a support when you're looking at implementing that plan. So having that conversation of, these are some interests that the child likes. These are some things that they do general across settings, whether it's at home and then transferring it at school. This is what the plan should look like. If there's a change, everyone is aware of that change. If there is some questions, if parents have questions, or if the team have questions about implementing the plan, as such as we were talking about professional learning, if they're unsure, such as like varying the task, what does that look like? Everyone has a voice in ensuring that the plan is implemented with fidelity. Yes, data is taken, but again, if someone is unsure about that, or what to look for, or how to read the data, or how to implement the data, that conversation is had early on. Trial levels are done as far as trials with the child. How does that look in the classroom setting? So again, doing that trial and error, and being transparent and understanding that, okay, if it doesn't work, we can come back to the table, because again, it's a plan, it's a strategic plan, and the plan has to work when everyone is on board, especially our parents. They should feel at ease. That's one of the things that we pride on our district, is making sure that the parent is at ease with that transition, as well as the implementation from the RBT, and then working together and having that conversation. So being able to have that meeting early on to make sure that everyone is on the same page, that consistency is the key.
Absolutely. I'm going to launch another little poll for our attendees about RBTs in classroom settings. And while people are getting their answers in, for Marika as an RBT, so how can we ensure that RBTs are seen as essential team members as opposed to either add-ons, or sometimes the opposite effect where they feel teachers might feel like they're coming in to take over the classroom? So how do we make sure that they do feel like they are team members doing this together?
Unmuting myself would be fine there. I would say a good way to make sure that RBTs and that they mesh well with the school is the first introduction. I would say introducing teachers to the RBTs, having an initial meeting, letting them know, all right, this is my role as an RBT. these are the, the issues or the things that you have going on. How can we come together and work together in unison where we can address the behaviors, to say the least? Sometimes it can come off a little bit. Who is this person coming into my setting? What are you doing? This is my place. However, an RBT is very knowledgeable of the cause, like what caused that behavior. Why did that behavior occur? In a weird way, we kind of have trained eyes to just see, okay, the pencil fell off the table. He didn't like that. Now we're throwing something. So we're able to be a little bit detective with our eyes and really are keen to see why the behaviors are occurring, and then being able to tell a teacher that, she's dealing with maybe 20 other students, might not have seen what happened to have that behavior occur. So then with the RBT there, they can say, okay, his pencil fell. He didn't like that. That's why the behavior is like this. We're going to ignore whatever we're implementing to address that behavior. But just doing a good introduction between RBT, teacher, principal, paraprofessional, and then just letting them know, this is my role. This is how I'm here to support you. I'm not here to tell you what to do, to say the least. So showing it as a teamwork more, to say the least. So.
Yeah, so Nicole, I know as a BCBA, you probably also have kind of your experience. So tell me a little bit about how you get that collaboration to work with your RBTs and your teachers.
Absolutely. So I've actually been in several classrooms where we were introducing either RBTs or BCBA or ABA therapy to classes and teachers that had never had it before. And so this is something I'm pretty passionate about, but it really starts from the top. It starts from the top. So as long as school leadership has communicated where their pain points are and what they're really hoping to achieve with the ABA team, the BCBA and the RBT. And then they've also communicated this with their staff. So the teachers are aware, this is what we're trying to achieve here. This is the support you've been looking for. We all see we're having these issues, and this is just supposed to be an additional way to help you with these things. And if that's communicated from the very beginning, the next thing would be for the ABA, the BCBA, and the RBT to come in with that same collaborative mindset. We are here to work with you together to solve the issues or the challenges that you've been experiencing here. And that way it doesn't become this competition of who's in charge of the class. It's we're all in this thing together and we're all trying to achieve the same goals. So I just think that it's really important. And then the last piece would be training, training across the board with a clear expectation of each team member's roles and responsibilities. And if you have all those pieces, I think it's just a great way to start off integrating that extra support.
Absolutely. And since you mentioned training, that kind of leads into the next question for my BCBAs. What kind of training or supervision structure makes school-based RBTs most effective, especially compared to, the home setting, the clinic setting? What's so unique and special about that supervision that you get in a classroom setting?
I would say, like I just said a second ago, a training for everyone involved. All team members should have some basic level of training as far as what ABA is, what our ethics are, the way that we go about trying to achieve our goals. And so that way, nobody's surprised and they can understand just the basic kind of concept behind what we're doing. And then we can have additional training that's really specific to what's happening in the class. And I think that's been really fun too, when we get to come in and support classrooms. If there's something specific that classroom is experiencing, we can actually make little mini trainings. I did one for DTT because the paras and the teacher had very little experience doing DTT, which is just another acronym, but it's just a way to teach kids in like little small increments, like new skills. And so I was able to do a training for that specifically. And then the other big thing as far as supervision, I think ideally the way that we do ABA therapy, at minimum, that board certified behavior analyst is supervising 5% of the time that registered behavior technician is in the classroom. And this just allows for continuous assessment of behaviors. It lets us modify programs based on the data that we're seeing. It lets us assess new functions. If we think a child is doing something for a different reason, or we're having trouble with something, or something's not working, it just gives the board certified behavior analyst a chance to address those issues. So it just makes sure that the therapy that's being provided is is accurate, it's up to date, it's based on what's actually happening, and we're constantly shifting and changing with the progress that the student is making. So that is, I hope I didn't say too much, but that is kind of
No.
what supervision
Yeah.
and training would look like.
Perfect. Yeah. So Marissa, I know you kind of have that dual certification. So what have you seen to be the most effective way for training and supervision to occur in the classroom?
Like Nicole was saying, the BCBA is already providing that 5% of training. And as a teacher, we're taught to teach, correct? Like we go through school to teach, but to a certain extent, there are teaching strategies that RBTs are taught as far as like prompt hierarchy, errorless teaching that can be used in a classroom setting to help further a child's education or academic goals. And so that is where the supervision of a BCBA in a classroom of a RBT can help broaden that skill set for the teacher and also for the student as well. A RBT can see that a kid does not know the sight word it and can implement a strategy that she learned from supervision to provide the appropriate DTT or arealist teaching he or she needs to be successful in that skill. We could also go into those living skills, those everyday life skills of the classrooms where kids are learning how to wash their hands. Supervision can help teach a child in a classroom the appropriate skills that we call chaining, task analysis. These are all things that RBTs would be trained under from the supervision, but as an educator, those aren't terms you hear every day. When I was teaching, I had no idea what chaining, task analysis, any of these words meant. I was doing it unknowingly, but I didn't know it. And so that goes back to what we said earlier as far as training is very important. And when you introduce the RBT to the teachers and they start to collaborate and work together, it makes everything, like beautiful. Like Dr. Smith said earlier, it's like a well-oiled machine. When everybody comes in and collaborates together, it makes it like a well-oiled machine. So that supervision, it takes, like I always tell people, I'm a teacher at heart. I always will be. My teacher hat and my BCBA hat goes together. And so I'm constantly in my clinic like, hey, let's do this. This is the skill set that I need to learn, but let's take um, this ABA term and pair it together. And now we've made magic. So that's my
Yeah.
input on that one.
Yeah, I've done school supervision and I love supervising in the classroom because you have all the opportunities. If a child has a hard time transitioning, there are going to be so many opportunities to hit that and teach it and provide training in real time. And if I miss it for circle time, there's going to be so many more opportunities and I'm going to get in the exact setting, the exact antecedent that's triggering the behavior. Whereas sometimes I've done in-home, I've done clinic sessions. You kind of have to manipulate it and it seems a little bit in a bubble where in the classroom you're getting it the way it's going to appear for that child every single time. Um, yeah, so let's move on. So we're talking about enhancing special education. So I'm going to launch another poll for our attendees about which best describes your district's current approach to classroom support roles. And I want to highlight Dr. Smith and her article on enhancing special education RBTs in classrooms for support. Dr. Smith, do you want to talk about a little bit about kind of your article, what you found, and kind of that memorandum of understanding for RBTs?
So, quick thing. It was something that's been inside of my brain for a mighty long time. And so when I got the opportunity to be the one to be the boots on the ground for our district as far as paraprofessionals and RBTs. And so it's funny that this article came about was really because people often get paraprofessionals and RBTs mixed up in our district. I'm not saying they didn't know, just saying they just like, oh, this is just an extra person. And so then I had to wave the flag and say, hey, wait a minute. Nope, that's not what it is. Paraprofessionals are registered behavior technicians are totally different. They have a skill set. Registered behavior technicians have a skill set. Paraprofessionals have different assets or different specific skills than a RBT. And so what a great way for me to be supervising the autism programs in our district as well as behavior support programs. I said, oh, let me go ahead and put my little scientific hat on, and we're going to roll with it since you gave me the opportunity, ma'am. And so I had the luxury of being able to place those students, place the registered behavior technicians in our autism classrooms. And so one of the things that came about with this particular article was, how was it going? Oftentimes we have a lot of buzz terms in education, and we typically use it for a little bit and then we just put it under the rug. But in this instance, it was more of, let's utilize specific skill sets and being able to implement those into our autism classrooms. We've had an increase of students with autism that came into our district, and trying to place them in various programs. We had specific programs, and thus making our numbers increase in the classroom setting. For state regulations and federal regulations, we had a lot of typically autism classes running around 10 students in a classroom. Fast forward now, increasing, looking at 25, 26, we have 16 children with autism in our classroom. So we had to also change the platform. With that being said, we needed registered behavior technicians to come in to help. And when I say help, different mindset come in from the clinical setting into the education setting. So in the article, it was geared more towards us being able to utilize a skill set, getting everyone on board, changing some mindsets. Again, it's a clinical thing with merging the education together. And so when we're looking at the article, it talks about how we blended that clinical support with the educational support. And one of my students that it was very successful. A lot of our students have been successful now, but now it's more of, okay, we got them in. We have a registered behavior technician. They're coming in. We're doing professional learning. They're teaching us how to implement a lot of different strategies. Let's change our mindset. Let's be open, because a lot of things in our education setting is closed. And when I say closed, it's more of, this is how we've been doing it for 275 years. This is what we're going to do for 275 more years. And I'm like, no, let's subtract that by 500. So do the math. I'm not a mathematician, but I do know that it was great when we had merged the two. And so a lot of advice that I would give for our district, for other districts, is to try it. Is not a bad thing. It's almost like ripping the Band-Aid off, like Miss Craft said, and she was like, Marissa said, and the magic happened. And it's almost like the golden leprechaun bucket just said, whoa, and everybody got it. And so it only took 3 months. We have different classrooms, not only in our autism classroom, but in our behavior support classes, utilizing those terms, the technology, as far as understanding our students. So even our nonverbal students who use other devices to communicate, we saw an increase in wanting to communicate. It wasn't a shutdown. When they had their person come in, or the registered behavior technician that was in the classroom, you saw an increase in communication. You saw an increase in their functional skills as far as asking for things. The motivation of the teachers increased. And so in practice, it may seem a lot, but on the front end, getting the early intervention in was one of the things that our district did a great job in doing. And so advice for the other districts, or other people who are just thinking about, hey, should we have an RBT in there? Well, yes, it's just like having a pen and paper. That's just like having that extra person in there, and not utilizing them as an extra person, but putting them, hey, let's come on, you on the team now. Let's go ahead, get your shirt, put it on, let's suit up, and let's get it done. And so you will see an increase across, just not in our special ed classrooms, but our students are wanting to go into the general ed classrooms with their RBT, of course. But then the RBT knows when to fade those supports off and say, hey, you got it. Communicate with your peers. Hey, you got it. Mom, we don't have to hold his hand to come in the morning time. Mom, he's going to shoo you off because you're doing too much. We're in school now. We're not at home. And then when the parents see that, you all, it makes a difference, because then they're carrying it not just in the school setting, they're also carrying it back at home, which our ultimate goal, if we think about it at the end of the day, is for students to be independent and not dependent. And so you're talking about students, and I tell that this all the time. You're talking about students who may be our surgeons, our upcoming doctors, our upcoming lawyers. You're talking about communicating. You're talking about some political platforms that our students can do. And it's all because we had that early on support. So this article really talks about the groundwork, but I am just so happy to see, and we'll be able to see how we're going to move forward and see our students perform, just having extra support. And it's not just support, but it's support for our students to make sure, hey, they have that extra person to come in and say, hey, you got it. So it's almost like an extra cheerleader in the classroom. And so with this article, again, we're expanding our RBTs that's coming into the classroom. We're expanding the supports they're given. We even have some professional learnings that our RBTs will be doing as well throughout the district for our students, for our teachers. Because again, we have to teach our teachers how to teach our students. So again, that's one of the things that we're priding ourselves on with that. And so this article is, even though it's just a little bit a snippet, I'm still, and I hope the panel and all of you would just, push forward and making sure that this is international, because it's necessary.
Absolutely.
Sorry, I talked too much, but that's it.
No. Did a lot of work, so we want to hear more about it. So, is there any, for Nicole, is there any evidence that supports the long-term benefits of RBTs in schools?
There sure is. There's a lot of research, and sorry about that. I guess I hit the button. Sorry about that. There's so many studies that just talk about the benefits of early intensive behavior interventions, just like Conchana was just talking about. And it's so exciting. And so I actually shared a couple of those studies. Hopefully that can get dropped in the chat for you guys to see. And I have more if you want more information. But there was a meta-analysis of early intensive behavioral interventions with children with autism study. And it's like a literature review that covered 34 different research studies. But it talked about how excuse me, there has been an improvement in academics, communication, just like Conchana mentioned, or Dr. Smith mentioned, social functioning, a reduction in challenging behaviors. And then there was another research article that I shared that talked about how unprepared teachers feel. They feel like they got a great education in teaching how to teach and how to break, words down when I'm teaching them how to read and whatnot, but they did not receive always enough education on how to deal with a variety of challenging behaviors. And so when an RBT can come in the classroom who is trained in that, they feel like they've got now some effective interventions, and they have an extra person who actually has the time and the ability, the knowledge and the skills to be able to implement those procedures to address those behaviors. And it allows the teacher to focus more on teaching. And so as far as like long-term and more grand, like how does this affect schools and districts? With helping each of those classrooms and each of those students, then you can see a reduced cost on, crisis intervention plans, and reduced costs on legal things. And then you see increased academic achievement, and you see less behavioral referrals. And then you have more opportunities for children to move out of their self-contained classes and be able to go into inclusion classes and have more opportunities to integrate with general ed. And so you just have so many amazing long-term, wide-scale results from being able to do really, really, truly effective ABA therapy in the education setting.
Yeah, well said. So I want to talk about kind of the value of the RBT in the classroom compared to a paraprofessional. Now, they both have their place, and I think they're both so crucial for classroom success. But Marissa, can you tell us a little bit about the value of an RBT compared to, the value of a paraprofessional?
As some of us know, that like paraprofessionals are people who are interested in the education system. They come in, they don't technically have like a lot, some of them don't have a background in education at all, let alone background in special educations. And typically in districts, because of budget cuttings and our classroom sizes, paraprofessionals are typically just kind of moved where they are needed. And the interesting thing about that is we know as professionals that our special education, that group is a very sensitive population that needs specific care and specific understanding. And sometimes when you lack first of all, the the basic understanding of children or education systems in general, and then you pair that with someone who has no training or any foundational understanding of special education, it tends to not work as well as when you bring in somebody who comes into the classroom setting with the understanding that I'm going to see behaviors. I'm going to have a little pushback. I'm here because that's what I know I'm going to do, and that's what I'm trained to handle. So the value of an RBT would be that they already have these ideas in their head. They're walking in the classroom knowing that this student is probably going to drop their pencil or throw it 3 times, but they understand that that's a part of this kid's dynamic and disability, and how they're going to work their way to figure out and use the skill sets that they've been given to help progress this student forward. Whereas a paraprofessional who has no understanding, and sometimes they operate on their own personal bias or their own personal judgment because they lack the training and they lack the skill set to understand that this is bigger than just because this kid doesn't want to. It really is a specific function that they haven't been trained to see. So the value for me would be the real basic understanding of the child and what you're walking into, and your preparation mentally, physically, to be able to handle what you're going to be up against in this classroom.
Yeah, absolutely. Thank you for that. Now, Dr. Smith, I want to kind of touch briefly on kind of how do we understanding the budget cuts that are happening while still focusing on that professional learning and the resources used. So how do you create that collaboration but also within the community?
One of the things that we've done, we've collaborated with some of, again, iDEAL Hire, in Team iDEAL. And so we have collaborated with iDEAL Hire. We've also had some third-party persons, other third parties to come in and do trainings. We also make sure that one of the major things is we work within. So again, we have trained professionals to come in and provide professional learning. We have behavior coaches. I have a good team of behavior coaches that come in, and we look at different aspects of professional learning. So we also collaborate with our universities surrounding, if they're interested in collaborating with us. And when we do a lot of collaboration, it's more of how does that look as far as the professional learning, like what topics we need to discuss. We also survey our teachers. We make sure that our teachers, as well as our parents, tell us what are some things what we need to do in order to make it a smooth transition. Also, what do we need to do what topics we need to hit. So this year, upcoming, they'll be doing an academy. So the academy will consist of different third parties as well as some onboarding staff, and then new teachers, because we're thinking about our new teachers as well, to come in and do professional learning. So not all the time we have to pay someone. We oftentimes utilize what we have because we know there are budget cuts. We know that there are minimal resources, but we try to use what we have. We're creative, and we're creative in utilizing what we have as far as our resources. We may go do a trainer model. We also do some drive-in conference sessions. So we go to the schools and we provide that support, which build capacity within the school level. So it's not just the special education teachers getting the professional learning, it's the special education and general education and administration getting that information. And so it's necessary as far as inclusive, because we talk about inclusion all the time. And so the professional learning is not just for our SPED teachers or the RBTs coming in from a third party. We train everyone. And so one of those things is being creative and knowing that we got to do what we have. We got to do what we got to do, regardless of how many resources we need. But pairing and having that conversation, being nice at the meetings, inviting people back, some of the simple things that we tend to overlook, building those relationships are things that we typically utilize as far as with us having those budget crunches. And we had to cut some things this year as well. So being able to have that conversation on utilizing our staff and being able to have that conversation about how we're going to do that.
Yeah, Yeah, I just want to take it to the chat and see what people are saying. It says, Leslie said, I think they are so right that there is a lack of understanding of what exactly an RBT does. It's just I've worked with, see, a para and a RBT as pretty much the same thing. And so I think we talked about identifying those roles and responsibilities and having that clear plan as soon as you come in and say, okay, what is a para going to do? What is an RBT going to do? How is it different? And then how do we manage that sometimes those lines might get a little blurred? Brooke said, this is all fantastic information. As a parent, I'm curious about my son's school structure. Dr. Smith, what advice would you have for a parent, if any, that wants to learn more about their son's school structure, and what questions could they ask?
So a lot of the questions to have is being proactive. And when I say proactive, having that having you know your child best, you're the biggest advocate for your child, looking at what programs they have in that particular school. What programs do you have in the district? Where is your son or daughter now? Are they coming in from a setting where they have not had structure? Because again, I'm big on early intervention. Or if they're transitioning and they've been in the clinical setting, we're getting a lot of this. They've been in the clinical setting since age 3, excuse me. And now we're getting ready to transition, and they're going to kindergarten, 6 or 7 years old, and they've been getting in the clinical setting. So the advice that I would give to parents is knowing your child's likes and dislikes, having that interest inventory set, what plan that they've been working on currently, what are some things that they can do. I will put out always, always, always. I tell parents, list 3 things or list no more than 6 things that your child can do. We often focus on what they can't do, what they need, but what are some things that your child can do? How does that help them throughout the day? Again, if they're communicative, if they communicate, how do they communicate their wants and needs? So those simple things, but don't be afraid to ask questions. What does this program look like? How long is my child will be in this program? How often do I need to meet with you all? What is the guide? What are the guidelines? Sometimes you may have to push buttons, and it's okay to push buttons because guess what? Your child is going to push buttons as well, and that's how we learn. We learn by those buttons being pushed. We learn by making sure that we're advocating for them, and we make sure that they're able to advocate for themselves. So any parent, any administrator, but particularly parents, being able to have that conversation and saying, this is what are my options, positive options, give, what ifs, ask those what if questions. Don't be afraid to ask those what if questions, but being able to look at those districts and seeing what programs that they're doing and ask them about their data. How does it look when my child is succeeding? What policies and processes you all have if my child is not succeeding? But being able to have those conversations and don't shy away from it, and being able to know that you put on that pom pom or that cheerleader hat on every day for your child, and they need you. That's what I would suggest.
Perfect. I just want to, okay. So Leslie said, I think if more schools understood that the RBTs coming in prepared to handle hard behaviors and the stress that these behaviors can bring would be minimalized. A calmer class is so beneficial for everyone. Absolutely. Absolutely. Brooke asked, for parents, who would be best to initially bring these questions to within the school board? Would it be the principal, the teacher, the PTA? Dr. Smith, who would you recommend?
I would recommend the principal, the building administrator of that district.
Awesome.
And then being able to have that conversation, schedule a conference with them. One of the things we do in our district as well is we're doing in 2 weeks prior to. If your son or daughter are going to a new school, then ask to do a tour of the school, ask to meet. Don't just wait to orientation. Sometimes orientation is really big. They have a lot of people in. So ask, have a conversation, ask for a conference prior to, and I would like to tour your school. I would like to just tour your school. It also helps with the transition for your child as well, so that they'll have a familiar place and they'll know about the familiar place. Ride by and say, hey, this is going to be your new school. Take pictures of the school outside if you can't go in, but being able to have that conversation with the building administrator and the program person at the school, If they're specific with the SPED department, ask for a SPED coordinator or a SPED director to also be involved. Because again, if your child has an IEP or if the child has a 504, you want to talk to the persons who are able to have that conversation with you and understand and make you feel at ease with the transition process.
Awesome. We have another question from, I want to say Alana or Elena, I hope I'm saying your name correctly. Do you see there being a new process, possibly even shorter time frame, that might help support teachers, staff, and parents that are working through the process of a behavior intervention plan?
So one of the things that, is that for me?
Yeah, for the whole, for
Okay,
everybody.
anybody? Okay, good. One of the things that when you're talking about, I'm gonna let Miss Kraft and Miss Robertson go through that one. But one of the things that we've done as far as the process, we try to encourage parents to trust the process, but also knowing that we don't want to speed up the process because again, that's where the balls sometimes drop. But when you're doing an FBA and a BIP, I always tell parents as well as teachers and things like that, if they already have one, that's fine. One of the main things is implementing and going through it. So not just having the behavior intervention plan, but actually showing and demonstrating when Quinshana has these behaviors, this is what the team should do. Not just talking about it, but I'm a big role player. Let's role play it. If I fall out on the floor, this is what needs to happen. If I'm physically aggressive, this is some interventions. So being able to have it's good to say, yeah, I have an FBA and a BIP, FBA functional behavior assessment or behavior intervention plan, but also modeling that. What does that look like? We miss that sometimes. What does that look like for our, especially for our general ed teachers and our SPED teachers who are maybe unfamiliar?
For my BCBAs, how do you balance educational goals with behavior analytic programming in a school setting? So how do we ensure that those clinical ABA goals still align with the student's IEP or academic targets?
I think that this school setting is the perfect setting for that. So you can start with having the BCBA and the RBT being involved in setting those IEP goals, not necessarily setting them, but just being involved. If you can do that collaboratively, you guys can be working from a plan that addresses the academics and the behavior. And honestly, where do we see a whole lot of the behaviors occur? We talked about transitions, avoiding tasks that are aversive to the learner, things that happen all the time. So you can be working on your academic goals simultaneously as working on your behavior goals. Whenever I pull out my math sheet, my student does XYZ, and you guys can work on those things together. And we get to, every time math comes, we get to work on academic goals and behavior goals together. Communication goals, how do we say that we're frustrated or we need help? So it all kind of works, not kind of, it does work together. I talked to a teacher and I was asking her what was like her favorite thing about having RBTs come into her classroom when she started. And one of the things that she said was, oh, my goals for my IEP got so much better. In addition to that, my data collection system also flourished because my RBT had all of this experience. They helped me set up, binders, and they had so much organization. And I had that extra person who, that is what they came into the classroom to do. They were taking so much data that I was able to make these really great academic and behavioral decisions because I had this amazing data to back it up. And so, yeah, that would be how you can address both of those things simultaneously.
Awesome. Now, Marika, can you
sorry.
talk a little bit about, sorry, Marissa, go ahead.
So this question for me is like a twofold. It goes into what Dr. Smith was saying, of course, what Nicole was saying. First off, like what we were going back to Dr. Smith's answer as far as the support or getting the help. Parents are the stakeholders, okay? They hold that weight in their hands and they are obligated to ask these questions. If you don't understand, get answers. And like Dr. Smith said, a lot of our kids are coming from early intervention. So like clinical, like from clinics like mine, they're coming from and they're going into these classrooms at 6 or 7 for the first time. And I have treatment plans that I've created. And so from my standpoint as a BCBA, on top of my standpoint as an educator, it is best to collaborate, work together to make sure that these goals are getting our students to the next point. We don't want just copied and paste goals of ABCs because they're 5 and they should know ABCs. No, what should we want to get there, or why is Johnny not doing ABCs? Is it because he lacks a certain skill set of a listener or amending or responding to answers. Sometimes it is hard for just teachers to identify. They think it's just a cognitively, like an academic, where it could be where the RBT would come in being able to say, like, no, I think he just has a problem with his listener skill set. That is a different conversation than the kid just not knowing how to do it or just being non-compliant. So we can ensure that the goals align by basically having the whole team collaborate on what the child needs. What is the biggest needs that this kid needs to meet to open the gates or the pillars to the next set of goals? And then the RBTs will be able to help address these goals in an actual real life time frame. Not something far-fetched, but something that is actually doable. And to answer the question in the chat about the time frame, I'm with Dr. Smith on that. You gotta let the BIP and the FBA do its job. As a BCBA, we operate on data. So my data has to drive my next step. The data has to push me. If the student had a bad week, that can't be the deciding factor on where we're going tomorrow. So the time frame seems so long when you're in the trenches of the behaviors, and it seems so dwelling and it seems so never ending. But remember that the data drives what we are doing next. It is all for the bigger picture to help us create these realistic IEP goals that we can help flourish a kid and make that magic we talked about earlier.
Awesome. Thank you. Magic. It's all about the magic that comes together with the data. Don't forget the data. So for Marika, as an RBT, tell me a little bit about that collaboration with the RBT and the teacher, right? So we know about kind of the BCBA teacher collaboration, how that goes together and how that can be beautiful. So what does it look like day to day between the teacher and the RBT, who you both have, the ultimate goal is this learner succeeding and flourishing. But how does it come together with your kind of individual professional goals?
Sure. So I'll take it a step back. I used to be an RBT for 15 years, and I think one of my biggest thing as being an RBT, I always wanted to go in schools because a lot of behaviors happened in schools that we weren't able to address. So they would have days where they were not able to stay on task, and then they would come home and they'd be like, "How do we fix this?" And I'm like, "Well, it's kind of hard to fix something after it's passed. Like we're able to work on it in the moment." And I've always wanted to go in school. So now I just feel like even though I'm not like in the RBT world, my heart is fluttering because now RBTs are being able to go in schools. I feel as though an RBT can work well with a teacher if that teacher is open to that RBT being in the presence. Dr. Smith made a very good point. Sometimes you go into a setting and a teacher is used to doing something 200 years and they plan to do it for the next 200 years. So you have to make sure when you go in as an RBT, you're going into kind of just hear where the teacher is coming from. What are some of the issues you're having? How can we work together as a team to address this? Because my main goal as an RBT is to come in to be an aid to the teacher and not this is what you need to do. You need to stop doing this, that, and the third, because that's not going to get us anywhere. I think another good thing to realize as well is if a child is fresh to getting any form of implementation or whatever, we could see a spike in the behaviors. And now we need to let the teachers know that, hey, this could go up a little bit, but it's not that anything is being done wrong. We're just responding to him differently by not letting him run outside of the classroom when math comes into play. Explaining this to teachers also lets them know that if they have a behavior in that moment and they run out of class, not to call their parent to pick them up. Because then what we're doing is teaching him that, hey, if I run out of class, mom's picking me up right after math. And then we've created now a whole behavioral problem where the school has seen the kid as the issue, but in reality, the school has created that problem because now, though that child may not have a lot of language, or they might have language, but children are very smart and usually are smarter than the people that are navigating them. So half the time, teachers and schools and parents create more behaviors because we're just kind of like, maybe it's like, oh, it's a quick fix because if we send him home, then now I can get to attend and teach my classroom. So I think where RBTs and teachers can come together is how we've said, having that first initial training, letting you know that I'm coming in to help and not to dictate. Because me as an RBT, I'm not a dictator. I like to hear and then I like to help. And so it's teaching teachers that this is something that's beneficial. It's not something that's supposed to be a headache. It's supposed to make the day run smoothly, just harmony to say the least, but it does take understanding what the teacher does, understanding where the RBT is coming from, and then having both come together and work collaboratively versus opposite ends of magnets, to say the least.
Yeah. So I want to kind of pivot the conversation into kind of those difficult conversations, right? So how do
Mhm.
we, as school professionals, initiate those tough conversations with parents regarding their child's potential and their need for extra support in the classroom? So I kind of want to start with Dr. Smith and kind of work our way down from the administrative level down to the BCBA, down to the RBT. How do we communicate that with parents that maybe a para isn't enough and we need to
Mhm.
provide extra supports?
So one of the things that we typically do is, and that I typically do is, I listen to the parent first. I listen to their concerns. I also, and they laugh at me because I say, okay, give me your top four concerns. And I say that because that's that task analysis in me, y'all. Don't know if I got that definition right, but that's what I do. So I ask the parent, what are some of their concerns? Where do they see Quinshana? Where do you see Quinshana for next year? And then looking at the data to see where they are now, having that conversation with them first. I typically do a one-on-one first, and then we come up with the option, a plan, parent and I, because I'm the first line of defense most cases. And one of the things that we do is we come up with a plan and then giving them the options, giving parents the options, bringing in the administrator, having a plan in place. And so sometimes we may have that difficult conversation where, you know what, Quinshana may need additional support. We may not need to transition her into the general education class yet. However, this is where we would need to be if we want to be in the general education class. This is where this is some things that we need to do first. Giving them a first, then again, that's a teacher tool thing too. First, we try this, and then if that doesn't work, having options. Oftentimes, we come to the table where we just want to say, this is what it is, and that's it. But we need to be a little bit more flexible, adjusting, and it's not giving in, it's not doing anything of that nature, but having that collaborative conversation and saying, I understand where you're coming from. I know that Johnny may need additional support. This is what the additional support may look like if we had this. This is what the additional support would look like if we took this away. So it really depends on the situation, what the behaviors are, if the school setting is appropriate, if they need a more least restrictive environment, that's fine. LRE is what we call it. If not, then how can we get those supports? Knowing the processes and understanding that we're all on the same team. And oftentimes, when we're having those combative conversations, is something, and I got a behavior hat as well. There's something that triggered it from the beginning, and so building that trust is the main thing in order for all of us to move forward. So again, it seems like, oh, that's not giving me enough. But again, you think about it. If I build trust, if I trust the team, then I'll be more as a parent, as a teacher. If I trust the team, I'll be more apt to move forward. So being able to have that trust and building those relationships, authentic relationships, genuine relationships makes a difference. So that's one of the things that we start out first. And then we come together as a team and discuss it. If we have to change something, then that's fine. But we typically do it that way as far as that.
I just wanted to add that we've talked a lot about like what RBTs and BCBAs bring to the table and how sometimes, teachers might need to change some things or maybe because I know Marika and Quinchana was talking about, hey, we're all part of a team. It's okay for us to like look at different solutions. But I also just want to touch on our side. We also, as BCBAs and RBTs, also need to come into the conversation respectfully, understanding that everybody is doing the best that they can with what they have to work with and not being judgmental and again just keeping it on the hey, we're all here just trying to figure out how to best serve these kids and these caregivers. And so if we just come in humble, all of us come in humbly together to try to just work together collaboratively, we can just assist with that piece of us coming in together and working together.
Absolutely. I want to take it to the chat. So Renee asked, what are the different options for support for RBTs? Is it one-to-one, float, classroom, or classroom groups would work?
I know for our district, and I know it's RBT question. One of the things that we've done, we look at what the child needs individually. We have not had a chance to do place RBTs in the classroom for for a group of students. Typically, when we're doing the placement or when I'm doing the placement, it's for a specific student. Next year, we're going to try to have where there's a paraprofessional and an RBT in the classroom. It just depends on the student.
Elena said, Marika, I love this conversation right now. I know there are so many teachers who feel like they're being judged when a support staff member is in their room. Looking at it as what it is support and not someone trying to take over. So kind of to everybody, how do we mitigate that the teachers' feelings that they're being judged because they have to have a support person in that classroom?
I used to
I
always
tell
come in.
them, oh.
Oh, sorry, Marika.
No, I was gonna say when I come in, I always tell straight up, I was like, I always let the teacher know, I was like, you're new to this, I'm new to your classroom. Just let me know what's going on. I said, I really want us to work together and not apart. And usually it's a lot of the times it's approach and it's how you come off. It's like you can't go into a new setting where you're going into a family, everybody knows each other, and then you come in like, oh my God, I know everybody and I can do all of this. And then you're going to be like, wait, who are you and what are you doing? So I think it's about approach and how it's initial approach. And I think that's where it comes back to once RBTs, it gets going. I feel like just as much as there's an orientation, I feel like there needs to be an orientation with special education teachers and the RBTs. They get together, they have an open discussion forum, because RBTs, yes, you can get put in later on in the school year, but I feel like it makes the year go so much better if you start off with it, then you guys work together, you're working through behaviors, and then by the end of the school year, nobody wants to leave and they want the babies they were working with because everybody has made the strides they need to make, kind of thing.
I just wanted to say, like Marika just said, that's actually what I was trying to communicate earlier, is that on our side, the way that we come in and the way that we initially approach the whole classroom can make such a big difference, because I have seen where behavior support comes in and the teachers almost cringe. It's like, oh gosh, here they are, versus, oh, hey, oh my gosh, I'm so glad that you're here. And it really comes from the way that you enter that class. And it needs to not be a judgy, I'm the expert, I know everything, and more like, hey, I know you've been in this class teaching this whole time. You know these students. You know what you've tried and what you haven't tried. And I know you only have 2 people in the class, and I already know that you have 14 kids in here, and I know. So I'm not coming in here trying to judge. I'm here to support. I am here. If the kid is engaging in behaviors, that doesn't mean that reflects poorly on you. That's the reason why they're in this special education program, because they need additional support. So here I am to help, not to judge. I'm here to help.
And I see where Elena also put, I saw in the chat where she said teachers are also on edge, because when I was a teacher, I can recall people coming in consistently to observe me and my teaching strategy. You got scored on it. Like I was scored on these things. So I can see from a teacher standpoint where it's kind of like, here's somebody in my room. I used to say when I became a BCBA, one thing I hated as a teacher was someone coming into my room who had never taught before. You had never taught before, and you walked into the room and told me to do this, 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 and this. And I'm like, whoa, Marissa's been flipping off the desk all week. What do you mean? So I can see from a teacher standpoint where it is a little bit like kind of standoffish, because typically when people come in, they come in to judge because you're being scored and you're being observed. So I just ask as a clinician that like we just change the perspective. Take your lens off and we go with the perspective that these people are here to support and we are here. And then as a clinician, like Nicole has said, like Marika has said, we have to come in the room with a humble presence of what do you need? Like, what do you need? And being realistic, we're not going to fix all these in this month. So what are the big things that we want to work on? Like Dr. Smith said earlier, she asked the parents, what's the 4 things you want? Like, what are your big 4? As a teacher, what's the top 3 things we're trying to get first? If we fix these first 3 things, then everything else can kind of flow and we can build a relationship. It's all about the relationship you build that creates a better working environment and a culture where you can see it as you guys are supporting each other. Because just as the teacher is learning from the RBT, an RBT will learn from a teacher. Because there are teaching strategies that an RBT has no idea what it is. So it's a team effort and a collaboration.
And
Absolutely.
can I say one more thing?
Of course.
Okay. So I do think sometimes we do miss the ball. And I'm big on this as an administrator piece, is the administrator having that conversation with the staff. Oftentimes, the RBTs, they're coming in the building, HR has already pushed them in. You start July 1st, and no one had a conversation with the staff. And so, one of the things I pride myself on, if I have someone that's going into my autism classes or the behavior support classes, I have a conversation with them at the beginning, everybody first. It starts at the top. If I have that conversation with staff and say, hey, Miss Craft and Miss Robertson are going to come in, and this is here, introduce yourselves, give them some expertise. We're here for Quinshana. This is what Quinshana's plan look like. Do y'all have any questions? How is Miss Craft is going to do this? How is Miss Robertson going to be in your classroom? She may come in at AM and PM. She may pull them out, but you all are the same team. I think we need to have a coach at the beginning to take the ice off, and then everyone thaws out. I like analogies. So again, as an administrator, when we're at the district level, when you're a principal, when you're assistant principal, anyone that are supervising or facilitating those classrooms, having that conversation with everybody first, so that when the RBTs are coming in or parents are coming in, everybody know each other. We don't have to all, tell each other secrets, braid each other hair, and eat Samoas. But what we have to do is work together so that the children can be able to push forward. So once we have the administrator have that conversation first, then it puts everybody at ease on their role. And so I do think it starts from the top. So that building administrator knowing that part, and bringing on the parent, and the parent knows. So the parent is not on the way. They're not just shuffled out, but having that conversation, being clear and saying, this is my school. This is how our school works. This is the plan for Quinshana. Hey, y'all, let everybody say hey to Quinshana. Everybody say hey. Having that conversation beforehand, so that the uneasiness with the RBTs coming in, the teachers, all of that will not be an issue. And I think it starts with the head. I really do. As far as administration, I'm off my soapbox. I'm just saying.
No, I know we've gone over on time, so I do want to, I see all of the questions in the chat box, so I'm going to take those, we're going to write those down, and I'm going to respectfully beg all my panelists to come back for a part 2 so we can get all these questions addressed. And keep the conversation going. So I do just want to thank my panelists for being here and opening up the conversation and continuing the dialogue for this collaboration. And it said we will send out some resources for you guys as well, so that you have them here. These are the resources that we'll send out for you guys. So thank you so much, everyone, for coming. And I appreciate all of the questions, comments, and I look forward to speaking with you guys again soon.